This morning on Today's Health, skin cancer. We all know the dangers, yet 34% of women still don't use a sunscreen as a precaution. Dr. Keri Peterson is an internist and a contributor to Women's Health magazine. Keri, good to see you.
Good morning, Al.
That's amazing to me. 34% of women, and I'm not even sure what the percentage is for men, but I'm sure it's probably just as high.
Yes.
We've been hearing all about these dangers for so long. Why so many people still not using sunscreen?
A lot of factors. First, if you work indoors, some people think, well, I work indoors, I'm not going to get sun exposure. But think about your commute. If you're driving, your left arm is at higher risk than your right arm of getting
Or
skin
if you've got
cancer.
a sunroof and
or sunroof, exactly, through the top of the car.
Right.
Or some people think it causes acne. Other people think it's already in their makeup. And for some people, certain chemicals can cause a little bit of stinging. So switch to a physical block if that's the case.
Okay, so you say it's important to watch your body in a sense, to monitor it, and so especially when you see new moles on your skin.
Yes, just as part of your routine health care, check your moles. If you notice that they're changing at all, see a dermatologist. And if you're not sure, interestingly, Women's Health in their June iPad edition, you'll be able to upload a photo and see if there's any changes that look cancerous.
Okay, folks who think, okay, I want to lay down that base tan, that's pretty risky, isn't it?
Just as risky as getting a significant tan, because any UV exposure can cause cell damage, causing wrinkles and skin cancer.
Okay, so there's some factors that you don't want to ignore. First of all, you say family history.
Absolutely. If you have a first-degree relative who has had melanoma, your risk goes up by 50%. And even with a distant relative, your risk goes up as well.
A blistering sunburn.
One blistering sunburn in adolescence can increase your risk by double what it would have been if you had no sunburns. And even if you have five mild sunburns, that also doubles your risk.
It's been in the news, tanning beds.
Yes, they have been in the news, and they are just as risky as the sun. They increase your risk of melanoma by 75% and of basal cell carcinoma by 69%.
Okay, so if you've got fair skin or light eyes.
Fair skin, you're at higher risk as well because your skin doesn't have enough melanin in it. That's the pigment that offers us innate sun protection. So you definitely need sunscreen if you're fair-skinned. And if you have light eyes, you're at higher risk for ocular melanoma.
But just because you have dark skin doesn't mean you shouldn't be concerned.
That's correct. Even though you have higher levels of melanin, you're still at higher risk.
And if you're in either a sunny or a high-altitude location.
Yes. If you live in a tropical climate, you have UV radiation exposure all year long. And at higher altitudes, even though it may be cooler in the air, for every 1,000 feet that you ascend, the risk of UV exposure goes up by 5%.
Sunscreen. I know you're supposed to use a shot glass full on your body.
Correct.
But if you've got sunscreen left over from last year, you say get rid of it.
Toss it. It has an expiration date, and if you also notice that the texture has changed or that it's separating, throw it in the garbage.
And what about a wide brim hat? Do you still need to put sunscreen in your face?
You do, because you can get UV exposure from the water and from the sand reflecting upwards.
And how often to put on sunscreen?
Every 2 hours, reapply.
Dr. Keri Peterson, thanks so much for great advice, especially as we get into the warm weather months.